Good evening, everybody. My name is Edwin Maldonado. I'm the Community Engagement Manager for the All of Us Research Program at the Medical College of Wisconsin. We want to welcome everyone to tonight's presentation, which is sponsored by the All of Us Research Program. The All of Us Research Program is a historic effort to collect and study data from 1 million or more people living in the United States. The goal of the program is better health for all of us and advancing precision and personalized medicine through research. Today's topic is liver disease. Again, welcome everybody. We have a couple of housekeeping things we need to take care of really quick here. And our presentation today is going to be like usual in two parts. First is the disease overview, and then the Q&A session. Again, if at any time you have any questions, please feel free to type your questions in the chat box or hold them for the Q&A section. You may also see a box that says Q&A. Feel free to type it in there also. If not, at the end, there will be a session for the Q&A where you can unmute yourself and ask the question if desired. Again, this presentation is being recorded, and the recording will be made available on social media through YouTube, Facebook, Twitter, or Instagram. You have been muted by the host, so please stay on mute unless speaking or given permission to. At the end also, we will do the drawing for $25 at the end of the presentation. So as long as you stay with us, we'll pick one of you to be the lucky winner for the $25. Today's speaker is Dr. Carlos Figueroa Castro. Dr. Castro is an assistant professor of the Department of Medicine Division of Infectious Diseases here at the MCW. He's done his residency as internal medicine at the Medical College of Wisconsin and also his fellowship in infectious diseases at Creighton University School of Medicine in Omaha, Nebraska. Dr. Figueroa Castro also has a master's degree in clinical informatics through Oregon Health and Science University. Dr. Figueroa, thank you so much for being tonight here with us to share with us about liver disease. At this point, I'm going to forward it to the doctor to take it from here. Thank you, doctor.
Thank you for the invitation and good evening to everybody. So we're going to cover some of the basics on the liver and liver diseases. Definitely not a comprehensive overview of liver diseases. The liver is one of the most complicated organs, multiple functions that we're not aware of, but we definitely need to take care of that organ. It's very important, and I think it's very relevant to know that a healthy lifestyle has a lot of impact on how your liver is taken care of. So it's one of those things that I think you have a lot of control on how you take care of that, of your liver. As conflict of interest, I do not have any particular conflict of interest relevant for this presentation. So starting with the basics to try to get on the anatomy and physiology of the liver. The liver is our body's largest internal organ. As seen on the schematic on the right side, where you can see where the liver is located in relationship with some other organs in the abdomen. It obviously resides protected by the right-sided rib cage, but as you can see, it's in contact with other organs as well, including the gallbladder. Then it's connected to the first portion of the small intestine that we call the duodenum, and on the schematic as well, you have some indications on how some of the blood supply comes out from the liver from two main sources that we'll mention in a minute. So the liver is basically divided into big sections that we call lobes, the larger right lobe and the smaller left lobe. It is separated by tissue, which basically anchors the liver in place on your abdomen. And each lobe is made up of smaller sections, and the that we call lobules. So that's kind of the primary structure, how the liver is organized for that organ to function, and gets the blood from both the portal vein, which is the vein that captures all the stuff that is absorbed in the intestine, and the hepatic artery, which is one of the branches that coming up with oxygen after being pumped out by the heart and being then pumped out through the big vessel that we call the aorta. So once those cells in that lobule start processing the blood and start filtering some of that blood, that ends up then collected in the veins and very small veins. Then they get larger and larger and larger up to the point that you end up with some hepatic veins that end up then connected to the inferior vena cava, which is the biggest vein in your body, which will end up connecting to the right side of the heart. So it will take that blood coming out from the liver back in circulation. So in addition to filtering out that blood from those two sources, through some of those metabolic processes, some of those functions that the liver does, it'll start collecting bile in those conduits that we call ducts. In a somewhat similar manner to those veins, those little ducts start coalescing and becoming larger and larger and larger up to the point that we have two big ducts, and then we have a common bile duct coming from the hepatic duct coming from the liver, which is also connected to the gallbladder. That bile gets into the gallbladder, so it's a store, and just when we eat, especially fatty food, that bile is already ready to do its thing and trying to absorb those fats. So instead of for the liver to start producing it, so we have this reservoir of bile ready to go. And that ends up emptying in the first part of the duodenum, very close to where the duct coming from the pancreas comes along. So again, we don't think too much about the liver. I mean, it's not an organ that makes any sound, and it's not an organ that necessarily you are very aware of what it does, but it definitely does a lot. It gets a humongous amount of our blood, so it gives you an idea how important that organ is. Just to have a sense of how much blood that is, just think about that at any given moment. Your liver has about a pint of blood. So a normal liver looks very, plump and reddish, and that just reflects the amount of blood in there. So that's about 13% of the body total blood supply. And as a filter, it really gets a lot going for it. So it gets about a liter of blood every minute. So that will be about 22 gallons of blood per hour. So ended up about 250 gallons of blood being filtered in a 24-hour period. So a lot of that blood supply pumped out by the heart ends up circulating to the liver, and anytime. So a lot of things happening because of that particular function. So as I mentioned, the liver has two sources for blood supply. One, that is the one that brings the oxygen fresh from the heart, which will be the hepatic artery. And the second source, which is very important for other purposes, is the portal vein, which will bring all the stuff that gets absorbed in the intestine. By far will be nutrients, but obviously some other things can get absorbed by that way. A very common example would be the use of, for example, when you take an oral antibiotic and some of that medication gets absorbed, and that's how that medication goes to your liver, which in many instances get metabolized and processed by the liver. So it can carry the nutrients, it carries medications, some toxins, and some other medications. Next slide. So again, very, very difficult to pinpoint every single function that liver does. If you try to count all the metabolic pathways and all the things that the liver do from a biochemical standpoint, we're talking about at least 100 different vital functions. Obviously, no way to go through those to every one of those during this presentation, but many of those functions are related to your metabolism. So how do you process different kinds of food, and how do you process fats, proteins and carbohydrates, very big, and some other situations that we'll talk about. So we mentioned some of the things that happen when the liver works. So we actually, liver produces bile, very important in the production of enzymes that allow and facilitate the absorption of certain components, especially fat, and also bile is how the liver gets rid of some substances as well. It produces proteins, very important for plasma, which is the fluid where that constitute the blood, where some other proteins, some of those cells in your blood, like your white blood cells, your platelets, your red blood cells, are traveling. Produces cholesterol, so it's not only the cholesterol that we eat, but we also produce cholesterol. Cholesterol has some certain important functions and in the metabolism, in producing hormones and giving some structural stiffness to the cell membranes. It uses the glucose that we get from food, the other processes that can convert some other sources of food to glucose, and then you can save that for later use as a form of glycogen, which is just like a really long chains of sugars attached to it, and it's just kind of your storage that you use when you need it, when you don't have a ready access source of sugar. So with that in mind, it's very important in balancing your sugar, and it's very important in regulating some of that as well. So you can see that it's not only the liver working by itself, but it also, there is a dialogue between some organs. In this case, for example, very important, that dialogue between the liver and the pancreas, for example. Next slide. It regulates the levels of amino acids in blood. So amino acids are the basic building blocks that makes proteins. Some of those amino acids cannot be made by the body and have to be taken by the stuff that you eat, but most of the times it will come in the form of proteins. So those proteins have to be break down in those particular components, the amino acids. So liver regulates that. It's very important in storing the iron that is coming out from the hemoglobin, which is this protein inside the red blood cells that are the ones that carry your oxygen coming out from your lungs, full of oxygen, go to the rest of your tissues, and then that oxygen gets released for all your cells. So that is carried by your hemoglobin. That hemoglobin has some iron on it, and that's how it's important to regulate how much iron comes out from those red blood cells. The red blood cells have a particular span life, which is about 120 days. And if you can imagine, the liver kind of recycles those old red blood cells and these different components. And one of those things inside those cells will be iron. And the liver is the one that kind of keeps that iron back and keeps it in circulation, keeps it stored, depending on the situation. Some things that we also process and convert when we are eating, especially protein, is the production of ammonia, which are basically nitrogen compounds that can be toxic. And then the liver takes care of those and they convert those into urea, which is non-toxic, and you can get rid of that through urine. And also very important, the liver is by far the main organ that processes medications and poisonous substances to try to get rid of them, making less toxics, and your body being able to get rid of them either by through the bile or then after putting them in circulations and the kidneys doing some of the job as well. Next slide. It regulates blood clotting, so our ability to stop bleeding by producing some of those proteins that are important in controlling that. It fights infections as well by making immune factors and removing bacteria from the bloodstream. So some of those bacteria will come also from the intestine. The intestine has this lining of white blood cells to try to protect you from those, because the inside of the gut will be full of bacteria, and obviously most of the time very important to have good bacteria inside, but when they go outside, that's when you can get into troubles. And the liver is the one that kind of keep tabs also as well, and maybe there's some small spillage of that. It removes bilirubin from red blood cells, so again, very similar to what happened with iron. and that bilirubin is converted so it can be excreted through the bile, and again removes harmful substances from our body. Next slide. So many causes of liver diseases. It affects millions in this country, and unfortunately, for various reasons, liver disease is on the rise. By far, the main causes will be not related to genetic or autoimmune disorders. Very uncommon for those two things to cause liver disease, but there are some conditions that can cause it. But by far, things like alcohol abuse, poor diet, obesity, infections, especially with viral hepatitis, and reactions to medications, street drugs, or toxic chemicals are by far the main causes of liver disease in this country. Next slide. So very different things can cause liver disease, but in the end, at some point, the damage that it does is, in the end, it looks very similar by the end of when you're having a more advanced disease. So most liver disease damage your liver in very similar ways, and for many cases, the progression is very similar regardless of the cause of the damage that triggered that problem in the first place. So the symptoms are relatively stereotypical regardless of the cause. It might not be necessarily a very acute presentation most of the times. It might start with something very non-specific, maybe some fatigue, some nausea, some vomiting, some loss of appetite. So again, not very specific at the beginning, and I'm sure that a lot of other things not related to liver disease can cause the symptoms though. But if you see this problem getting more complicated, you might see something a little bit more specific for liver disease. Next slide. That's the point where maybe there is an advantage of detecting liver disease before you start having these symptoms. So you can have an earlier diagnosis. You might have a chance of maybe reverting some of those changes because the liver is one of those organs that really regenerates compared with other body tissues. So if you can detect this early and you can correct some of those situations, you have a pretty good chance that your liver will recover. So without symptoms or with very non-specific symptoms, sometimes it's difficult to make that diagnosis. So it's very common for your doctor to request what we call a set of liver function tests in your blood. So it's a blood test that measures different things that are made mostly in your liver, some particular proteins that are very important in liver function, some other substances that can give you a very broad picture of whether liver disease might be present. Actually, in some situations, might give you some clues as to what kind of liver disease you might be having as well. So some of those things that get measured in that liver function test panel will be things like albumin, which is a protein that is made in the liver, and it's very important to try to keep that fluid inside your veins, for example, among some other things. It will measure the amount of total protein. It will measure some particular enzymes that are very important to process food and breaking down that food in very simple components. So we measure things called alkaline phosphatase, transaminases like ALT, AST, or GGT. Those enzymes are particular proteins that are very important in those metabolic pathways. And most of those metabolic activities happen in the liver, so they're a pretty good surrogate of liver function in first place. So we're able to measure bilirubin, which again is a substance that gets rid of by the liver through the bile duct, and we can measure the prothrombin time, which is a way to measure how your clotting system is working. By measuring the amount of time, and this test should be, so in a normal person, a prothrombin time should be between about 10 to 15 seconds. A prolonged period of time suggests some problems with the coagulation factors, and they usually are related to problems with the liver. So very relatively cheap test, very standard panel of tests that can be done by your primary care provider. And again, some of differences between those results might actually give you some clues exactly where the main problem could be, whether it's something happening within the liver or maybe something in the bile duct affecting the way the bile gets rid of from the liver. So give you some ideas what the problem could be. Then after, if the symptoms of liver disease are not detected earlier, you might start seeing some symptoms. Next slide. So you can start seeing something more suggestive for advanced liver disease, like for example, this abdominal pain and swelling. The technical name for that would be ascites, which is this collection of fluid kind of seeping out into this uh, area in the abdomen. And in some occasions, that fluid can get infected, and that can cause problems in the way actually not only your liver works, but also your kidneys work as well. So it's a very bad indicator. And sometimes the patients have to have this fluid taken out on a regular basis through a needle, the procedure we call that paracentesis. You can see in the picture that the abdomen is kind of large. You can barely distinguish where the navel is located. You can see on the top that you can see some of those veins, and the top tend to be a little bit more prominent. You can actually see them. That doesn't happen in a normal person. And you can see all these kind of bruises right here and there. So some of those hallmarks of liver disease can be present there. Next slide. Not necessarily as the only symptom of the liver disease as a cause of swelling, but definitely can cause problems with leg edema and edema that can be bad enough that it start affecting other parts of your body. So again, it's a very similar mechanism to the fluid collecting into the abdomen. So again, kind of the protein that is supposed to be made by the liver is down, and then the tendency of the body is actually to get the fluid that is inside your blood vessels to start seeping out and start getting within the tissue. And that's how you get this case of what we call pitted edema. So the person is trying to put pressure right there on your leg. It removes the finger, and then the indentation of that swelling remains. So that's a pretty significant edema right there. Next slide. In more advanced cases, then you will see the yellowish face, changes on the skin, and also it affects the white part of your eyes, right? So it's not only the skin, some other things can cause that change in the color, like for example, eating a lot of carrots and some other things that have carotenes. But you will see the eye, the white of the eye becoming yellow with that. So that's what we call jaundice. So you will see, or icterus, you will see this yellow tinge, and this basically biliruins that instead of being get rid of through the bile, it start accumulating in your skin and some other tissues. That can also cause some of the itchy skin that you can see in patients with liver disease. Next slide. So those are some of the symptoms. You might see some other things happening in more advanced cases, and we'll talk about that when we see some of the complications with liver disease. But again, one of the main messages that I would like to convey today to you is that it's very important to try to come up with an earlier diagnosis of liver disease, regardless of the cause. An early diagnosis, again, will more likely than not be allowed you to have the chance to recover some of that function. Again, the liver is very resilient at some point, and they'll be able to recover some of that function if you diagnose things earlier before some of the advanced damage happens. When you start having this significant liver disease, you're having this scar tissue, and scars, like any other scars, don't go away. That tissue is a tissue that doesn't really regenerate and becomes liver tissue, and that's when things become irreversible and you start having problems that we call cirrhosis, where you have this severe damage on your liver by this fibrosis, this scar tissue that starts, instead of having these lobules with that allows all these functions of the liver to do, then you start replacing that tissue with fibrous tissue, with scar tissue, so you don't have a liver to begin with to do what it's supposed to be doing. Next slide. So that fibrosis can be tested by different ways. The gold standard will be to do a liver biopsy, but it's a procedure. It can be risky. You might have bleeding and some other situations. So the first thing that a person and a specialist will actually will do first, most likely, will be to try to do your blood tests. And like we saw before, and also they will use an ultrasound to try to measure the stiffness of the liver. So you can imagine the scar is kind of tight. It doesn't really stretch too much, so it's very stiff. And there are ways that the radiologist should be able to measure that stiffness, and that stiffness, it can be used as a surrogate for fibrosis on the liver. In some instances, it might be pretty good and good enough that sometimes you don't need that liver biopsy. But in some occasions, especially when you're not sure necessarily what the problem might be, the biopsy might be the way to go in first place. Next slide. So it's an schematic, but it's not uncommon to see in patients with advanced liver disease those very visible changes in the whole organ. So again, you see in the left what it should look. It's very soft and smooth and friable and plumpy, full of blood, full of life. And then you can see the one on the right having all this lumpy appearance, kind of pale, yellowish replacement. That's what we don't want to see. That's when the damage has been done, and it's kind of late to see some of that regeneration. That's when we have cirrhosis. And on cirrhosis by itself, regardless of the cause of liver disease, it's going to put the patient at risk of having liver cancer, regardless of the cause. So those patients with cirrhosis need to be monitored for liver cancer as well. So you can imagine the liver, if it doesn't have really good tissue, then is when you start having organ failure. So the liver is not doing what it's supposed to do, like other organs failing. But again, the liver does a lot of things, so you can see a lot of problems with liver damage, and I think it's very enticing to when you see there's maybe some machines that might be able to replace some of the organ function at some point. We have hemodialysis for replacing some of the kidney function. We have these machines that are able to oxygenate your blood, and which have been becoming very useful, especially during the COVID-19 pandemic in very severe cases of COVID-19 infection. And obviously, there are some ways to transplant the heart with an artificial hearts. Not the most common thing. There are some other things that you could do for that. But there is no really good machine that replaces a liver because the liver is such a complicated organ. So you have to love your liver. That's probably another teaching point of this session. You have to really take care of your liver. So it's not working, you'll end up with liver failure. You're going to have an increased risk of liver cancer, which by itself can cause liver disease, and obviously death is what we want to not to see related to liver disease if we can help. Next slide. So some patients will end up with this scar tissue for various reasons, and that's what cirrhosis is basically. Some patients might have not have necessarily what we call decompensation. So it's there, it causes, it have the scar tissue. They may have some chronic fatigue. The appetite might not be that great. They start losing weight even without trying. Maybe some nausea, some discomfort. So not very specific symptoms, but we know that the damage has been done. In decompensated cirrhosis is when some of those situations that we see with liver disease start really causing a lot of problems, and that's how many of those patients can really die from decompensation of that liver disease. So what kind of things you'll see? So you will see, again, the patients with the jaundice, with very yellow eyes, the yellow skin. Patients will have complications related to something called portal hypertension. So if we go back in time a little bit on what we have learned so far, the portal vein, the one that connects the intestine to the liver, that brings all the nutrients, everything that we eat and drink back to the liver to be processed. Uh, Try to imagine that the liver, instead of being this nice filter, very plumpy, letting the blood go all happy to do all these processes, then it finds a stiff organ, an organ that is full of scar tissue, full of these nodules. So you just imagine that it's like a block sink, and that pressure starts building up backwards, and those veins start kind of plumping out, and not only that portal vein will start filling out full of pressure, but other veins in that abdomen and in the esophagus, the tube that connects our mouth to the stomach, start getting all bigger and plumpier, and that's a very serious complication of liver disease, because some of those vessels, especially in the esophagus and the stomach, they can bleed. And you can imagine, if a person not only having problems with bleeding from that, but they also might have problems with the way they clot, um, they can die from bleeding. So those patients, we definitely want to keep an eye on. That's the patient that might need an endoscopy, a camera going through the esophagus, and in some occasions they'll have to put some bands to try to cut down the risk of bleeding, among some other things that gastroenterologists or hepatologists will do. So that's also explanation why that buildup of fluid in the abdomen happens, that ascites, and that those plumping of the veins, the technical name for those will be varices. Again, very similar to what we see in legs, but instead of being on the legs, you will have them in those internal organs. You will see also patients with hepatic encephalopathy, which will be patients having these mental status changes, that confusion, which happens mostly because the liver is unable to get rid of some of those toxins that get built up by the food that we eat. Again, we mentioned that when we eat, we absorb and produce ammonia, and that ammonia, if that doesn't get processed into urea, then it starts building up in your blood, and that can affect your nervous system. It also, you have also increased levels in your bilirubin, and that can also cause problems with your mental status. That's called kernicterus, and patients can die from that as well. And you can see some very manifestations, not only the confusion, maybe, but you also see patients having this particular tremor related to bad liver disease that we call asterixis. Next slide. So again, kind of the schematic to try to explain some of the these plumping of those veins because of that liver being all scarred and not allowing the blood to go well. Then you can see some of those varices in the esophagus, in the stomach, getting all filled. The spleen will also get bigger in size because, again, that vein, that splenic vein, is connected to the portal vein, and the spleen will get bigger, and then with that you'll have a decrease in your platelets, also not a good thing if you're having problems with clotting and bleeding, and that start affecting some other organs. So you might have also problems with the way the kidneys work, and that also contributes to the retention of water in these tissues that is kind of difficult to put back into circulation. Very difficult problem in the hepatorenal center. Next slide. So risk factors, again, many things can cause liver disease, but by far the most common ones are related to heavy alcohol use, the classic example of alcoholic cirrhosis, obesity, type 2 diabetes, tattoos or body piercings. The main reason for that is the risk of contagion with hepatitis C and hepatitis B. Injecting drugs using shared needles, same story with viral hepatitis. Blood transfusion before 1992. The reason for that is that before that, we didn't know about the existence of hepatitis C. And it wasn't until that the mid 1990s that the blood products started getting tested for hepatitis C as a universal measure. So patients who had received blood transfusion before that might have gotten contagion from a blood transfusion with hepatitis C. Exposure to other people's blood and body fluids, again, hepatitis B, hepatitis C, unprotected sex, same reason. Exposure to certain chemicals or toxins, and family history of liver disease, very important as well. Next slide. So, one slide back if you don't mind. Thank you, I appreciate it. So, if you see that many of the causes of liver diseases are things that we do ourselves, so we have certain kind of control, then trying to prevent liver disease shouldn't be that difficult because that's mostly in our hands. We have alcohol consumption, diet consumption, exercise, avoiding risky behaviors. I mean, it's something that I think we have in control in principle. So, alcohol in moderation, avoiding risky behavior. So, you're having intercourse, use a condom. If you're going to have a tattoo or some sort of body piercing, be very picky about where you want to get those procedures. Same for intravenous drug users, sharing needles, don't do it. Simple as that. If you have liver disease or you're going to be in a place where maybe you're going to be exposed to this, we definitely recommend you to be vaccinated against hepatitis A or hepatitis B. So very uncommon to have liver disease with hepatitis A, with hepatitis B is possible. But the main reason to suggest the vaccination is that we don't want something else on top of a person having liver disease. The last thing that the person with cirrhosis is a new viral hepatitis that could have been easily prevented with a vaccine. Use the medication wisely. The medication have to be followed as prescribed, as indicated. Definitely some medications taken the wrong way can cause liver disease, and in some cases it can be irreversible. Something as simple as a Tylenol, if you take too much of it, it can cause really bad problems. I'm sure patients can die from Tylenol overdose. Obviously, avoiding contact with other people's blood and bodily fluids, like we mentioned before. Keep your food safe. Be careful with aerosols sprays and protecting your skin when using insecticides, other toxic chemicals. Follow the manufacturer instructions for protection and maintaining a healthy weight. Those are things that you could do to try to decrease the chances of liver disease. And I think that is the end.
Yes. Thank you so much, Dr. Figueroa Castro. That was eye-opening, to say the least, but very informative. At this point, we are going to open up for questions. So if you have any questions, please go to the chat box or the Q&A box and type in your questions. If you'd like to ask the question out loud yourself, please say so on the chat or the Q&A section, and then we'll unmute your mic so you can ask that question. So a couple questions I have right off the bat, and I had it right here. We go. All right. Can liver disease affect neighboring organs like the gallbladder?
So, I mean, there are some diseases liver diseases that can start from problems in the gallbladder. There are certain cancers, there are certain infections that like to affect the bile ducts and so forth. So the liver by itself is not like it's going to push on it or it's going to start infiltrating the gallbladder. It doesn't quite work like that necessarily. Cancer will be something a little bit different depending on the kind of cancer, depending on the aggressiveness. But most of the times it will be, cirrhosis is kind of a secluded thing. It affects the liver, but obviously it will affect the function of some of those adjacent organs, but not necessarily blocking things or affecting some other adjacent organs. But it's very dependent on the cause of liver disease in first place. Many diseases that can affect the liver starts in the gallbladder. They can start in the bile duct connecting the liver to the duodenum, and the presentation might be different. It might be the bile being obstructed. It might be problems with feeling that you eat and then you feel full right away,
Right.
or pain right after eating, things like that. But the cirrhosis itself, that inflammation is not going to start invading other organs in your abdomen or your thorax.
Right. One of the questions we have is, as far as genetics go, is there any particular race where liver disease is more predominantly over another race?
It depends of the genetic condition. Again, they're very rare, very uncommon situations. By far, common things will be like hemochromatosis, Wilson's disease, to name probably the most important ones. There might be some ethnic groups or racial groups that might be affected, but it's very dependent on the genetic condition. It's very dependent on the molecular mechanism as well.
Okay, great, thank you. And another question, how fast can liver disease progress to liver cancer?
It's very variable, depending on the cause. I will say, it depends on the cause. Or again, it sounds like a broken record right there, but it's very, 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 very depending on the cause. Some patients might have really acute liver disease, so you don't have enough time for that fibrosis to promote cancer.
Hmm.
So, for example, a person having a bad Tylenol, overdose, and having liver failure from that, that person, if it survives, is not going to present with a liver cancer right away. So, most of the time, is the kind of process that takes years, most of the time. So, for example, a person with uncontrolled hepatitis C infection, that you had hepatitis, you could easily be harboring that infection for 10, 15 years before you start having some difficulties, even longer.
Hmm.
And it might take a little bit longer even to develop problems like hepatocellular carcinoma, which is the kind of cancer that we are more afraid when a person has cirrhosis. There are some particular cancers that might show up by itself, and obviously some other cancers might end up in the liver as metastasis. So very
Hmm.
variable in the presentation. But generally with cirrhosis, it takes a while to show up. It's not going to be showing up in days or weeks.
Okay. And similar to the previous question, is there any difference in how liver disease affects men and women?
Again, I think the presentation is very, very similar. I mean,
Hmm.
uh, both will end up with with the symptoms, with the jaundice, with the ascites, with the portal hypertension, with the swelling, and in that sense is tremendously similar. If I'm honest, I will say in men, I mean, they have some difficulties in producing hormones, so it's not uncommon for people with cirrhosis to have small testicles, for example,
Hmm.
because of that low testosterone related to liver disease. But the presentation tends to be very, very stereotypical. Same difficulties with liver cirrhosis, same difficulties with the complication, with the
Hmm.
varices, with the hepatic encephalopathy.
Okay. And um, what should be something in your life that you will know, or in your body that you will notice quickly, that you should be concerned about? I know you mentioned a couple there with the swelling and things of those nature. Is there any kind of a warning sign in advance that can make you think, well, I better go check to be safe?
Like I said, I mean, I mean, it's just kind of maybe some of the difficulties sometimes of diagnosing liver disease. You can have that and for quite some time
Right.
before you start having symptoms. And the symptoms at the beginning could be very non-specific. A lot of things can cause fatigue, malaise, nausea. So it's just a high degree of suspicion. I mean, if you have a family history of liver disease, or you're having some difficulties with your weight, or problems with uncontrolled diabetes, or you drink too much. It could be as
Mm-hmm.
simple as that.
Yeah.
I would probably try to be a little bit more pushy with your provider and say, I have this concern. Would you consider having a liver function test? Start with something very simple and take it from there.
Okay. And I have one question here that says, if someone is anemic or has an iron deficiency, can that push um, kidney disease at all? Could that be part of a cause or could be one of the symptoms?
Of kidney disease or liver
Yeah,
disease? Sorry.
a liver, I'm sorry, liver disease. I'm sorry. Yeah.
Yeah, so that's kind of maybe some questions right there
Hmm.
within that question. I mean, iron deficiency anemia. I mean, by far, the first thing that you have to think about is loss of blood from the gastrointestinal tract. That's by far
Right.
one of the first things that you want to rule out.
Hmm.
In this country, very uncommon to have problems with you not having access to iron-rich foods most of the
Right.
times. So it's not a problem of you having the building blocks. Uh,
Right.
Most of the time, the problem is that you're losing those building blocks, and by far the ways you lose that is with gastrointestinal bleeding.
Hmm.
Um, I will say that you can have different ways of having anemia with liver disease. The one
Hmm.
that will be definitely more scary will be bleeding from those varices. I'm pretty sure that can cause
Oh, yeah.
iron deficiency anemia, and that's the kind of anemia you don't want to lose time with.
Sure,
Uh,
sure,
but
sure.
but again, depending on the mechanism, depending on the liver disease, liver disease, I'm pretty sure can come with inflammation,
Right.
uh, and that inflammation also can signal your body how to handle the iron, and it starts instead of being given and
Hmm.
the body saying, hey, this is the iron, take my iron to produce more red blood cells.
Mm.
The opposite might happen. They get very stingy with releasing that iron,
Right.
and you might have those building blocks though, but you can use them to produce more red blood cells.
Hmm.
So at least I can think in a couple of mechanisms right there that can cause anemia. If your liver disease is affecting your kidneys as well, I'm pretty sure that kidney disease can cause also anemia, because that's very important. The kidneys have a very important role in how they tell the bone marrow to produce more red
Right.
blood cells. So at least I can think in different mechanisms that can cause anemia.
Okay, very well. Thank you. Are there any other questions or anybody would like to ask a question? If for some reason after the presentation's done you think of a question, please feel free to give us a call or send us an email and I'll give you the contact information towards the end. And then we can always approach Dr. Figueroa Castro for an answer, and then we'll add that on to our taped presentation. Like I said before, this is being recorded, so this will be presented on YouTube, Facebook, different places. So again, Dr. Figueroa Castro, thank you so much for your assistance and your presentation. Really appreciate that.
My
We
pleasure.
all, thank you. We are going to go to the drawing. We mentioned the drawing before in the beginning and a couple of things that we have looked at the roster of who's here and we have a winner. The winner has initials JP. JP. We will confirm via phone or email within the next 48 hours if you are the winner. Once we reach out to you, you have 2 weeks to respond so we can make arrangements on how to give you the prize. It's a $25 cash prize for assisting here. Again, the initials are JP. We will not mention your name out of respect and of confidentiality. But if that is your initials, you may be called within the next 48 hours. Um, Again, thank you for coming up. We will repeat this presentation in Spanish in 2 weeks. And again, Dr. Figueroa Castro has been more than gracious to assist us for the Spanish version of it. If you know of anybody who's interested, please let them know to come back on the 28th or to look on YouTube for the presentation. We will provide you with the link and everything of that nature. And then in the month of May, we'll be doing a presentation on arthritis, and more information will be coming up to that. After this event, please take a few minutes to complete a short survey. Or again, you can email us at allofus@mcw.edu with your suggestions. Again, my name is Edwin Maldonado. Our contact information, we're part of the Medical College of Wisconsin. Our address is on the screen. Our phone number is 414-955-2689, or you can email us at allofus@mcw.edu, or go to our Facebook. We're at All of Us MKE, or join allofus.org/Wisconsin. Thank you so much for being with us tonight. We wish you to stay healthy, stay safe, and we'll see you again in a couple of weeks. Thank you and have a great evening. Again, Dr. Figueroa Castro, thank you so much for your presentation.
You're welcome.
Thank you.